5 years too late. How public health authorities hid the risks, ignored the data, and now act shocked. Welcome to Wake Up Canada News. I'm Brad Wilder. This next article was researched and written by one of our Wake Up Canada News contributing reporters. So here we are in late 2025, and suddenly the FDA is acting like someone just discovered gravity. After 5 years of mass COVID-19 vaccination, regulators are reportedly planning to slap the most serious warning label they have, the infamous black box warning, on the very vaccines they pushed on the world. That's right, the same products they touted as safe and effective from the start are now facing the kind of caution reserved for drugs that might cause life-threatening harm. Let's unpack that. In late 2020, these vaccines were authorized under emergency use, legalese for we don't have long-term safety data, but we're going to go ahead anyway. At the time, regulators told us to trust them. Benefits outweigh the risks. But at no point did they spell out how uncertain that safety profile really was, or how little they actually knew about serious side effects that only emerge when you've vaccinated millions of people. And now, half a decade later, some officials are acting like that's new news. It's not. According to reports, the FDA's internal discussions even suggest that COVID-19 vaccines have contributed to the deaths of at least 10 children due to heart inflammation, and the agency is now broadening safety reviews across age groups. That's right, signals that officials brushed aside or downplayed are suddenly worthy of black box consideration. Remember all those reassuring headlines, the ones that said the vaccines were safe and effective for everyone from the toddlers to grandparents? Well, it turns out they were not. The Vaccines Adverse Event Reporting System, or VAERS, an official surveillance database managed by the CDC and FDA, collected massive numbers of adverse reports after COVID-19 vaccination, report numbers far above what's normally seen for any other vaccine. Now, VAERS accepts reports from anyone and doesn't judge whether the vaccine caused the event. But even that should have raised red flags years ago. What does massive mean? Before COVID, VAERS typically got about 60,000 reports a year across all vaccines. Once COVID vaccines were rolled out, total reports skyrocketed into the hundreds of thousands, far beyond the historical baseline. The CDC and FDA themselves have acknowledged that they monitor any event reported after vaccination, regardless of whether it was proven to be caused by the vaccine. Of course, public officials and mainstream outlets have pointed to analysis showing that most reported reactions are mild and non-serious, and that our serious events are rare. And then there were studies linking mRNA vaccines with rare cases of myocarditis, heart inflammation, especially in young men, which regulators eventually acknowledged and updated labeling for. But let's be clear, if myocarditis and other risks were truly rare and fully understood, we wouldn't be hearing urgent talk of black box warning 5 years later. That delay exposes something a whole lot bigger. Regulatory bodies were slow to recognize, slow to communicate, and even slow to act on emerging safety signals. And during that time, billions of people followed the official playbook, trusted the guidance, took the shots, and believed they were being told the whole truth. Even now, with this supposed pivot, transparency remains elusive. Officials have said they intend to release data backing any formal warning, but that hasn't materialized. And critics, yes, including some former regulators, are publicly warning that decisions are being driven by evidence being made public. And let's talk about effectiveness. In certain seasons, there were studies suggesting updated shots reduced emergency room visits among children during particular waves of COVID. Yes, that still matters. But effectiveness at reducing a rare infection in a largely previously exposed population is a far cry from the original blanket assurances that these vaccines would always prevent transmission, infection, or even severe outcomes for everyone. Yet those assurances, they shape public policy, mandates, and personal decisions worldwide. They lied. Millions died. The bottom line, we now have regulators adding the strongest warning label available for vaccine, years after it was rolled out under emergency terms and marketed as safe enough for everyone. That's not just slow, it's breathtakingly negligent. It's the regulatory equivalent of shrugging after the fact and saying, well, oops, guess we should tell people now. The timing speaks volumes as well about how safety data was handled, how risks were communicated, and how trust was traded for reassurance during a crisis. For the millions of people who made difficult decisions for themselves and their families based on official guidance, decisions backed by promises of safety and effectiveness, this late-breaking warning talk feels like, well, an after-the-fact admission that the story we were told was a deliberate deception. And make no mistake, people will remember. People will ask why it took 5 years to acknowledge what some scientists and clinicians were raising as signals early on. People will ask why transparency wasn't there from the start. Because when it comes to public health, there's a big difference between protecting lives and protecting narratives. Thanks for watching Wake Up Canada News. Please like, share, and follow us on any of your favorite socials, including Facebook, YouTube, Rumble, BitChute, and our website at wakeupcanadanews.com. Till next time, remember you're the voice, and it's time to make it count. I'm Brad Wilder. I'll see you soon.